1 in 3 women and 1 in 2 men are going to get cancer in their lifetime. So it's going to be very important to know about effective treatments to be able to treat cancer. And vitamin C is one of those.
You're watching the Dr. Jake podcast.
I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician in Salt Lake City, Utah. On this channel, I share with you how you can heal your body and get your energy back without any drugs or surgery. Be sure to subscribe for more videos like this one. So let's begin. There's a lot of myths about IV vitamin C and how it's harmful for the body, or it might make your cancer worse, or it might interfere with your chemotherapy and radiation. On this video, we're going to be able to talk about what's the research really saying and really find out, is vitamin C good for you or not? So this is a great trial that I've really enjoyed because the researchers in this trial asked a lot of questions about that we need to know about IV vitamin C. And they did a ton of research on it. This has 100 research articles on it just on vitamin C and IV vitamin C to answer these questions. So I really enjoyed this. I think the viewers are going to really enjoy being able to dive into this research. I'm just giving a skim of it, but we're going to be able to supply this research below, and you're going to be able to dive into it to yourself. But the name of this research article is Intravenous Vitamin C for Cancer Therapy, Identifying the Current Gaps in Our Knowledge by Carr and Cook. So they talk about 6 different questions that we should have regarding vitamin C. Number 1 is, do cancer patients have low vitamin C levels compared to healthy people? Is IV vitamin C safe? Or is it better to do oral vitamin C versus IV vitamin C? Is vitamin C good to do with my chemotherapy and radiation? Does it decrease the side effect profile of chemotherapy and radiation? And what is the mode of action of IV vitamin C? So I think these are a lot of questions that I get asked all the time from my patients are these type of questions. This research article has all the research to back everything that I say to my patients. So let's dive in. They did a ton of research on this. They looked at all kinds of different research articles on this specific issue and compared, okay, do people with cancer have lower vitamin D levels than those that don't have cancer? And what they saw is, in majority of the cases, that people that have cancer have low vitamin C levels. And in many instances, they have something called hypovitaminosis, which is severe low levels of vitamin C. So I'm not necessarily saying if you have low vitamin C, you're going to get cancer, but this research is pretty concerning that people that do have cancer do have low vitamin C levels. Now, there's a lot of questions that aren't being answered by this research article regarding this, but we are seeing that, okay, you have low vitamin C levels, you might have increased risk. And probably you should be taking vitamin C if you want to help prevent vitamin C from getting cancer. That's what I'm getting, kind of the conclusions I'm getting from the research that they did in this research article. They did a ton of research on this and they looked at several different articles, but my favorite one was done by Pauling. It's a research article that was done in Russia in 1976. And what they found in their research is they did a comparison. People doing oral vitamin C, they did people doing 10 grams of IV vitamin C, and they saw really great results with people that were doing IV vitamin C. And they did even that comparison that I'm talking about with the oral vitamin C, and they didn't see great results with the oral vitamin C. So the conclusion that they found is you're going to have good results treating various types of cancers. They did it for all kinds, breast cancer, ovarian cancer, prostate cancer, etc., and saw good results with the IV vitamin C of 10 grams or more. We have even more research now since 1976 on IV vitamin C, and 10 grams is actually pretty low, but they actually were getting great results with just doing 10 grams of vitamin C. I usually do at least 25 grams to 100 grams of vitamin C for my patients that have cancer. But what's very interesting, shortly after this research article was done, is there was a study that was done by the Mayo Clinic. They said, hey, whoa, we're seeing good results on IV vitamin C. We're going to do research articles and see if we could get the same results. At least that's what they made it sound like. So what they did is they did a study. They did a vitamin C study, and they found out that vitamin C wasn't effective for treating cancer patients. What's interesting about this is what then oncologists started recommending to people is like, hey, don't do vitamin C or IV vitamin C at all, because it doesn't really show that it has any benefit at all in treating cancer. And they did this for at least 10 years or more, until a researcher actually looked at the research that the Mayo Clinic did, and they were like, hey, this is not the same as the pollen research. The pollen research even said that oral vitamin C wasn't the best way to treat cancer, but in your trial, of the Mayo Clinic trial, all you did was oral vitamin C, and you didn't do any IV vitamin C, and really only went up to like 1,000 to 2,000 milligrams of vitamin C, which is like nothing. So it was very interesting how that was done. I want to be skeptical and be like, I think they were just trying to make it like IV vitamin C was bad. They didn't want any conflict of interest. I don't know. I don't know why they would do the trial they did, and didn't really do the exact research study that the pollen research did. But that's what a lot of medical oncologists refer to, and they still refer to this research article today of the Mayo Clinic showing that vitamin C was not effective. But that was oral vitamin C. The pollen research in Russia found out that oral vitamin C wasn't good for active treatment of cancer. Now, I do think oral vitamin C can be a great preventative. We are seeing that it is low in people that have cancer compared to people that don't. So I think that's good. But if you want to actively treat cancer, you need to go with IV vitamin C. And this is very clear in this research article. They did a ton of research on this, that you need to do IV vitamin C if you want to be effective on treating cancer patients. In this research article, it was greatly positive, saying IV vitamin C is extremely safe. There's really no harm that comes from IV vitamin C if you have the appropriate testing done. You need to just make sure your kidneys are working. With 99% of people, their kidneys are working just fine and great, but you do need to check to make sure that your glomerular filtration rate, your creatinine, these are kidney levels, are not that you have way too high creatinine and your GFR is too low. Because when you get a lot of stuff in the body, like a high amounts of vitamin C, your kidneys aren't able to filter it out. But most people are going to have this problem at all. And also, you want to rule out a deficiency of G6PD. So if you have a deficiency of G6PD, this is going to make your body not be able to take oxidative stress. Vitamin C causes high amounts of oxidative stress on the body. This is extremely rare. I've only identified this once with the thousands of patients I've tested for this, but you definitely want to get this test done before you do IV vitamin C. They even did a trial on 9,000 different patients, and what they found is that only 1% of people have mild side effects to IV vitamin C. And these mild side effects are fatigue, malaise, and vein irritation. That's 1%. And that's just having a little bit of fatigue after getting IV vitamin C. So it's a very safe treatment if it's done appropriately. If you're doing it with a doctor that knows what they're doing, it's not going to cause any harm whatsoever. And if you're one of that 1%, it's not really going to be a big deal either. So this was a great result for IV vitamin C that is very safe. I know I have a lot of patients that go to conventional doctors. They tell them they're doing IV vitamin C, and they tell them, I don't know if it's really safe. They're being a little ignorant there. They need to really look at the research. And I love just being able to share research articles with the medical oncologists, even though they usually don't read the research articles. But I love sharing it with them so they really understand what we're doing, and we're not going to cause any harm to our patients when we do these treatments that are trying to get over their cancer diagnosis. And what this study found also is that vitamin C is really good with chemotherapy and radiation. If you've been to your medical oncologist, probably many of you that are listening to this go to your medical oncologist and they say, hey, you don't want to do IV vitamin C because it's going to interfere with my chemotherapy that I'm going to give you. And that's another ignorant statement. They haven't really looked at the research. I know they're trying to be like, vitamin C is an antioxidant. Our chemotherapies are being very oxidative on the body. That's how they work. So you don't want to do an antioxidant. But they aren't really knowing about the mode of action. We're going to talk about that at the end of this video, really the mode of action of how it's not going to really interfere. It's more about oxidative therapy and not an antioxidant when you do high doses of it. But what they found is that chemotherapy and radiation did really well with IV vitamin C. They did a study on ovarian cancer patients that were receiving paclitaxel and gabapentin, and they tested also doxorubicin, 5-fluorouracil, and they found that those patients had greater decrease of side effects from the chemotherapy that they were using. So they weren't having as much swelling of their abdominal cavity called ascites. They weren't getting as much nerve pain. They weren't getting as much brain fog. They weren't getting as much of those digestive sores or the mouth sores that can happen. So it was helping decrease a lot of the side effects that happen. And also a big one from especially Dr. Rubinson is heart damage, and it was helping decrease that. So doctors saying that don't do vitamin C because it might interfere with treatment are just wrong, because it's actually going to help improve side effect profile. And they have actually seen in the research articles that patients are going to have greater responses to chemotherapy and have better results with IV vitamin C also. They also have seen the same results with radiation. There was only one negative trial that was done in the research, and what they said, and this was only 1 out of 10 or more research articles that I was seeing here, is they saw it that they had a negative trial when it was within a 2-hour span of getting radiation. So what I'm recommending to my patients is typically you want to be done with your vitamin C a couple hours before you do the radiation treatment, or don't do IV vitamin C a couple hours, to wait for a couple hours after radiation to try to decrease some of the potency of the radiation, because it has maybe some effect on decreasing the potency when it's done too close. This is just one research article. The other research articles weren't necessarily seeing this, but I still do recommend this, and probably a good idea to be knowledgeable about that. So this is a really cool one. I really like it because what vitamin C does is it only kills cancer cells and doesn't cause any harm to our body, and actually helps heal a lot of modes of action in our body and makes our body actually work more effectively. So how it works is vitamin C looks a lot like a glucose molecule, and cancer cells can't decipher that between a glucose molecule, and they suck it up. So when you put tons of vitamin C in there, cancer cells are like, oh yes, I have tons of sugar, I'm going to gobble that up, and they gobble up the vitamin C. So it's kind of like a Trojan horse type of thing. So what happens when the vitamin C goes in the cancer cell, it gets broken down into hydrogen peroxide, and then cancer cells don't have the mechanism of action to break down the hydrogen peroxide. So the hydrogen peroxide causes damage to the cancer cell and undergoes a process called apoptosis, which is cell death of the cancer cell. Our normal cells take up the vitamin C. It gets broken down into hydrogen peroxide inside our cell, but our normal cells break that down into water. It has all the cell mechanisms of action to do that. So it causes no harm to our normal cells throughout our body. And like we're saying here, it has oxidative effects on the body, making that hydrogen peroxide production. So doctors being concerned about the antioxidant effect, when you do high doses of vitamin C, it's not. When you do low doses of vitamin C, it's antioxidant. When you do high doses, like via IV, it's more pro-oxidant when you do 25 grams or higher. So I hope this research article will help you guys, and I hope it was opening up your minds to the understanding of vitamin C. And maybe you could go into talking with your medical oncologist or maybe your integrative doctor and talk really knowledgeable to them about IV vitamin C and why you want to do it. So it's not necessarily going to harm you at all. It's just not going to help attack the cancer cells. But what it can do, let's say you're doing chemotherapy or radiation with it, and you're doing high doses of vitamin C orally, that can be a problem. You just don't want to do concurrent use with oxidative therapies like chemotherapy and radiation. But if you're not doing those therapies, vitamin C can be really good, and it can be a good preventative. And you do want to boost your vitamin C, like we talked about in this study, that most people with cancer have low vitamin C. And one reason I think theoretically, that's just me thinking about the modes of action of how the body works, is probably they're low in vitamin C because the body's using up all the vitamin C.
Interesting.
And that's why you're really deficient in that, because your immune system is hyper-stimulated trying to take care of these cancer cells, which it uses up all our vitamin C. So then it decreases in that reason. So that's one theory I have behind why people with cancer have low vitamin C status. I think people with cancer are many times not eating appropriately and not eating a great diet many times. So they are going to be deficient because they're not eating fruits and vegetables, which is where you get the vitamin C. And usually they're cooking it and not doing it raw, which is when you cook it, it destroys the vitamin C. But that's just a side tangent of vitamin C. So yeah, they're done in my office, and they're watched over by me and other doctors that know what they're doing with IV vitamin C. And you come in 2 times a week, and usually an IV vitamin C treatment takes about 2 hours. And usually we're doing about 25 grams to 100 grams, depending on the patient and what dose we need to do for that specific individual. So that's how that therapy works. You come in our office two times a week, and usually we are doing that to start 15 treatments on average. But sometimes we do even more than that. So let's say we're getting great results with the IV vitamin C. We did 15 treatments and I'm seeing good results and the cancers are decreasing in size or they haven't grown at all. Usually then I'm going to put them on a maintenance protocol and I'm usually doing a treatment every 1 to 4 weeks to keep on continuing the treatment, doing what it needs to do and be a good preventative treatment. Let's say the cancer is pretty much eliminated. And I still am recommending patients come in every 4 to 8 weeks to do IV vitamin C just to keep their immune system strong. So I don't typically take a break from IV vitamin C if I'm having good results with it. If you want to learn more about IV vitamin C or other great treatments, click my video to the right. I'm Dr. Jake, and I'll see you there.